Nearly 800,000 people in the US experience a stroke each year, making it a leading cause of long-term disability. In this video, 7 warning signs of stroke a week before it strikes, we'll cover 7 critical stroke warning signs that should never be ignored. Knowing these signs and acting quickly can save lives. A stroke happens when a blocked artery prevents brain tissue from receiving oxygen and nutrients, causing cell damage or death. But before we begin, please help us spread this life-saving information by hitting the thumbs up. If you're new here, subscribe to Natural Remedies Dose and click the bell icon to stay updated. Plus, stick around to the end for 2 amazing free heart health gifts. Let's get started. Number 7. Sudden numbness. Sudden numbness or weakness is one of the most alarming early signs of a stroke, and it often affects only one side of the body. This symptom, known as hemiparesis, typically presents with a sudden inability to move or a feeling of numbness in the face, arm, or leg, often on one side. For instance, you might notice a drooping face, difficulty in raising one arm, or even a dragging leg. These signs are crucial as they point to a disruption in the brain's blood supply, which could be a precursor to a full-blown stroke. According to the CDC, approximately 87% of all strokes are ischemic, meaning they occur when the blood flow to the brain is blocked, often leading to such unilateral symptoms. The reason for this one-sided weakness is linked to how the brain functions. The brain's left hemisphere controls the right side of the body and vice versa. Therefore, a stroke impacting one hemisphere can manifest as weakness or numbness on the opposite side. It's also important to note that even mild symptoms shouldn't be ignored. Research shows that early intervention can dramatically reduce the risk of long-term disability. Coming up next, we'll explore how strokes can subtly interfere with cognitive functions and communication, often before more obvious physical symptoms appear. Number 6. Trouble speaking. Cognitive issues and communication problems are critical stroke symptoms that require immediate medical attention. A stroke can affect the brain areas that control language, making it difficult to speak, understand what others say, or express thoughts clearly. These impairments can be subtle, but are often key indicators of a serious medical emergency. One of the most common signs is slurred speech, where words may come out garbled or difficult to understand. Additionally, individuals may experience trouble finding the right words, often pausing mid-sentence or using incorrect words without realizing it. Difficulty understanding spoken language is another red flag. Someone having a stroke might not be able to follow a conversation or comprehend simple instructions. For example, a person experiencing a stroke might struggle to repeat a simple phrase like, "The sky is blue," or answer straightforward questions such as, "What is your name?" These symptoms can vary in severity but should never be ignored, even if they appear to improve after a short while. Fast action can help prevent further brain damage and increase the chances of a full recovery. Stay tuned to discover the next vital warning sign which might catch you off guard with its subtlety. Number 5. Vision loss. Vision loss can be a frightening experience, whether it occurs in one eye or both. This condition is often associated with strokes, leading to symptoms such as blurred vision, double vision, or partial complete loss of vision within the field of view. When a stroke impacts the brain region responsible for visual processing, these visual impairments arise. The extent of vision loss is determined by the location and severity of the stroke. Some individuals may only encounter minor visual changes temporarily, while others may grapple with lasting vision complications. Regardless of the duration of symptoms, seeking immediate medical attention is crucial. Prompt intervention for stroke-induced vision loss is paramount, as it can prevent irreversible damage and potential blindness. Recognizing the signs early and receiving timely treatment can significantly impact the outcome and quality of life for individuals affected by stroke-related vision impairments. It is essential to prioritize eye health and consult healthcare professionals promptly to address any concerns related to vision loss following a stroke. But vision problems aren't the only signs to be aware of. Up next, we'll explore how a stroke can affect your ability to move and balance. Number 4. Difficulty walking. When experiencing sudden issues with balance and coordination, it could be a sign of a stroke. These symptoms are often accompanied by feelings of dizziness, vertigo, which is a sensation of spinning, or general instability. Individuals may struggle to walk in a straight line, finding themselves stumbling or staggering. In severe cases, loss of balance can result in falls. Your care team may also monitor for complications such as loss of bone density or strength, which can be prevented through physical activity during rehabilitation. These motor difficulties arise when a stroke impacts the cerebellum, a region of the brain responsible for maintaining balance, coordinating movements, and ensuring precision in physical actions. As we've explored some of the early warning signs of a stroke, it's crucial to remember that awareness is just one part of the equation. Lifestyle choices play a significant role in stroke prevention. Did you know that nearly 80% of strokes are preventable? This underscores the importance of managing risk factors such as high blood pressure, smoking, and obesity. For instance, maintaining a healthy diet rich in fruits, vegetables, and whole grains can significantly reduce your stroke risk. Regular physical activity is equally important, helping to keep your blood pressure in check and your heart healthy. However, prevention isn't just about personal habits. It's also about community and conversation. Every time you share what you've learned or engage with others about stroke awareness, you're contributing to a broader understanding that could save lives. After all, the more we talk about these risks and how to mitigate them, the better equipped we all are to prevent strokes from happening in the first place. Now, let's continue to uncover more warning signs that could indicate an impending stroke. Number 3. Severe headache. While headaches are a common ailment for many, a sudden and severe headache with no apparent cause can be a harbinger of something far more serious, a stroke. Often described by sufferers as the worst headache of my life, this type of headache can strike without warning and with excruciating intensity, signaling a potential hemorrhagic stroke, which occurs when a blood vessel in the brain ruptures, leading to bleeding within or around the brain. This headache is not your typical tension or migraine headache. It's usually characterized by a throbbing or stabbing pain that may be concentrated on one side of the head or spread across the entire head. The sudden onset of this severe pain is what sets it apart from other headaches. According to the American Stroke Association, hemorrhagic strokes, which account for about 13% of all stroke cases, are often more deadly than ischemic strokes. If you or someone else experiences this sudden severe headache, especially in conjunction with other stroke symptoms, it's vital to seek immediate care. Early diagnosis and treatment can significantly reduce the risk of severe complications and improve the chances of recovery. Up next, we'll discuss a symptom that can make you feel unsteady and disoriented. Number 2. Sudden dizziness. Sudden dizziness, feeling faint or experiencing an unexpected fall can be alarming, and these symptoms should not be taken lightly. They may be indicative of a transient ischemic attack or a full-blown stroke, both of which are critical medical emergencies requiring immediate attention. A TIA, often referred to as a mini-stroke, occurs when there is a temporary reduction or blockage of blood flow to the brain. Although the symptoms of a TIA may resolve on their own within minutes to hours, they serve as a serious warning sign. These episodes of sudden dizziness or imbalance might also be accompanied by other symptoms such as difficulty walking, nausea, or even vertigo. Such symptoms are often misattributed to less serious conditions like dehydration or inner ear issues, but the stakes are much higher when it comes to stroke. Timely intervention, which may include diagnostic imaging and possibly clot-busting medication, can significantly reduce the risk of further complications and long-term damage associated with strokes. Coming up next, we'll discuss how one overlooked symptom can provide a critical warning before a stroke occurs. Before we unveil our number 1 sign, let's build some anticipation. To help you fight heart disease more effectively, we're thrilled to offer 2 extraordinary free gifts we've compiled just for you. First, we're giving away our exclusive ebook, 7 Foods That Clean Arteries and Prevent Heart Attacks. This isn't just any list, it's a treasure trove of delicious foods that help maintain healthy blood pressure and support your heart. And next, you'll gain access to a breakthrough video, The Shocking Cause of Cardiovascular Disease and What You Should Do Starting Today. This video reveals an ancient signaling molecule used by our ancestors, offering a revolutionary approach to restoring optimal heart health with what we call the nectar of gods. It's essential knowledge you won't want to miss. To claim these incredible gifts, simply click on the link in the description below. Now let's return to our countdown and unveil the number 1 warning sign that stands as a crucial pillar in the 7 warning signs of stroke a week before it strikes. Number 1. Nausea or vomiting. Feeling nauseous or experiencing sudden vomiting, especially when combined with other stroke warning signs, should never be ignored. These symptoms can indicate a critical medical emergency requiring immediate attention. Often overlooked, nausea and vomiting can signal serious issues related to the brain's blood supply or potential brain damage. Research from the American Stroke Association highlights that around 10 to 15% of stroke patients report experiencing nausea or vomiting during the onset of a stroke, underscoring the importance of recognizing these symptoms. Understanding the FAST acronym, face drooping, arm weakness, speech difficulty, and time to call emergency services. By doing this, you can help quickly recognize stroke signs and ensure timely medical help. By staying vigilant and responding swiftly to these signs, you can play a crucial role in improving outcomes for those affected by a stroke. Your quick action can make a life-changing difference. So there you have it, 7 warning signs of stroke a week before it strikes. Now, we'd love to hear from you. Have you ever experienced any of these signs? How did you respond and what steps did you take afterward? Share your experiences in the comments below. If this video has illuminated new possibilities for you or reinforced your current health strategies, please show your support by hitting the like button, subscribing to Natural Remedies Dose, and hitting that notification bell so you get instant notifications whenever we upload new videos. And for those considering showing extra support, the Super Thanks feature is a great way to help us continue providing valuable health insights. Before you go, remember to check out the links to our 2 exclusive free gifts in the description below. Remember, your health is in your hands. Thank you for watching. Stay vigilant, stay informed, and here's to your heart health.